Hello, everyone, and welcome into Senior Living Live. My name is Melissa. As always, thank you so much for watching, and I hope you are having a wonderful day today. Now, as we continue our commitment to provide you news you can use, information to arm you with the latest and greatest about senior living, I'd like you to meet Ben Green. He is the president and COO of Insurance Advantage. If you need help navigating life insurance, Medicare, long term care insurance, Social Security benefits, retirement, Ben is absolutely your man. Ben, I know you're a busy guy. How are you today?
Great, great, Melissa. Thank you for having me on. It's an honor to be with such a fantastic interviewer.
Oh, well, I appreciate that. And you have a fantastic background, and you're going to tell us a little bit about that as we kind of venture into the topic of Medicare today. Tell us a little bit about yourself.
Yeah, yeah. So I'm president and COO of Insurance Advantage. We're based in South Carolina, but we do work all over the country. And we started out helping folks with Affordable Care Act plans and kind of migrated over to Medicare in the last 5 years, and have from there kind of built a practice around pre-retirement planning. So Medicare, long-term care, life insurance, annuities, even helping folks with Social Security questions that they have. That's what we do. And I'm also proud to say I'm a regional director of the Financial Education Partnership, which is a nonprofit that really leads and provides financial literacy for free for folks. So it really helps, makes me excited to be able to help educate folks on these topics.
Yeah, and I do find it impressive too. You're multilingual and in conversation, so you can help out really a large number of people. And tell us a little bit about that too, in case somebody's watching and needs a little help on that end.
Yep, yep. So spend a little bit of time over in Japan and Spain and Brazil, and so really I appreciate the fact that I've been able to learn some different languages, but it's really applicable to what we're going to talk about today because Medicare in particular is is its own language. We're not taught it in high school, or I didn't have to, take a class in college, or even when I got my MBA. And so it makes me excited to be able to share a little bit of information today with folks.
Yeah, fantastic. So, we've all heard the term Medicare. I think everybody, you've been living under a rock if you have not. But what exactly is it, Ben, and who is eligible to receive it?
Yeah, so Medicare it's health insurance for folks that are 65 and older, typically, or if you are under 65 and you have certain disabilities like ALS, for example, Lou Gehrig's disease, or other types of disabilities, you can qualify for Medicare. And anyone that has end-stage renal disease typically is going to qualify for Medicare.
Excellent. So, here quite a few different factions of individuals there. We have seen some options right out there, but what really is available if you're putting it on paper, and how much does it cost?
Yeah, yeah. So Medicare, it's kind of two parts basically. So Part A is typically your hospital insurance, and that's the eligibility for that is typically you have to have 40 quarters of work, if you will, either for yourself or as a spouse or as a child. And you can file for Part A, and it's usually what we call premium free, or it's a $0 premium if you have your 40 quarters of work, basically. Part B is medical insurance to go see doctors and so forth, and that is also a voluntary program, if you will. And the eligibility for it is that you have to apply for it, and you have to pay a monthly premium for it. And that monthly premium for most folks, if you're single under the age of if you're single and under about $87,000 per year, that premium for Part B is going to be about $148 per month right now.
Gotcha. And how has some of this changed? You consistently hear that everybody wants to help Medicare and to help people with Medicare or through Medicare. How has that kind of changed over the years since you started? I mean, what's the latest and greatest about Medicare, so to speak?
Yep. So the plans that you can choose, if you will, are always changing. And I'd like to kind of share a little bit with you about that. And so so Medicare itself covers, and original Medicare covers 80% of your costs. So Part A covers, as I said, the hospital, 80% of your hospital stays Part B covers 80% typically of your doctor and outpatient stays. Um, and that's the good news, it's 80%. The bad news, or your responsibility, if you will, and this is what changes all the time, and this is where folks really kind of need some help, is that you have to cover that additional 20% of the gap. And then you also have to be responsible for getting a Part D drug plan, a prescription drug plan. And so that is what is always changing. Those the 20% sort of supplement policies and the Part D plans are always changing. And what's always changing is the cost of Part B. About 4 years ago, Part B was around $100 per month per person, and now it's $148. It's been going up a little bit every year. And then the Part B deductible, which you're responsible for as an individual, that's going up every year. It's about $203 per year now. It used to be less than that. So every year there are some changes that are always being made, and so that's why it's really important to either be an expert in this yourself, or reach out to someone like myself, or like independent brokers and agents who would kind of walk you through this process for free.
Yeah, reach out to the pros. And what did I hear? Did I hear the word free?
Yes, yes, yeah.
Okay. Now, do
Yeah.
people know this?
A lot of folks do not know it, and that I think is why they sort of brave the elements on their own, and deal with the phone calls and deal with some of the unsolicited mail that you may see, or a call into some of the things that folks see on TV with promotions about Medicare plans.
Wow. So before we start to talk about enrollment, let's go back to you mentioned that there's that gap there, that some people are needing a little bit of help to maybe fulfill. What can you give in terms of advice on that, and to somebody who says, well, I don't know if I can afford that on my fixed income?
Sure. So option to fill the gap, you have two options essentially, especially when you're turning 65 years old. You have option number one here on the left, as you can see, which is called typically a Medicare supplement plan. You may also hear it called a Medigap plan, and those plans they have the alphabet with them. So like a Plan G or Plan N, for example, or those plans are available, and they help to fill the gap in terms of co-pays, in terms of co-insurance for your plan. They fill that 20% gap. And those plans can range in price from $70, for example, per month, up to $120, $130, depending on your age, your state, and even your county, actually, or your zip code. The Part D plans, which are the drug plans, those plans range in price from $7 up to $150, depending on what your prescriptions are. But essentially, you need to dig in based on what your current prescriptions are, who your current doctors are, et cetera, to figure out whether or not you're going to go with an option number one, particularly based on your budget. Option number two, which is called a Medicare Advantage plan, or also called a Part C plan. Those plans are becoming increasingly popular now, based on budgeting sometimes. And what they do is they essentially combine Part A with Part B, and they're administered by private companies. And they also a lot of times include a drug plan and additional benefits like dental and vision, for example, and hearing. And so really based on your network, based on the doctors you need, your prescriptions and so forth, we typically sit down with folks and figure out what best meets their needs.
And as you're going through the alphabet, I mean, you can really get into the weeds here. So this is something that, I mean, if you can get the help, and as you mentioned, Ben, it's free, you should probably take advantage of that. So on that end, if somebody's watching, they're listening, how can somebody enroll? Is there a window of opportunity to enroll, or can someone do it anytime?
That's a great question. So you can so the general enrollment is on the initial enrollment period, or IEP, if you will, and that is typically when you're turning 65. You have about 3 months beforehand and 3 months afterhand to enroll. The other times to enroll, or to maybe change your plan, for example, are during the open enrollment period. That's typically from October 15th to December 7th. Okay, and that's for Medicare. not to be confused with the Affordable Care Act open enrollment period, which can confuse a lot of other folks. And then you do have some other special enrollment period times based on your like chronic conditions, for example, or if you do happen to qualify for Medicaid, for example, or for another special government program.
Yeah, so if someone's dipping their toes into this for the first time, you bring up Medicaid. What is the difference between Medicare and Medicaid? I don't think I could even tell you.
Yeah, so Medicaid, obviously we already explained what Medicare is. Medicaid is it is a jointly funded state and federal medical assistance program that is designed to help people, but you have to have a certain level of income. And so it's means tested, if you will. So if you're, for example, in South Carolina, that level is $12,880 per year as an individual. If you go over that, you will very likely not qualify for Medicaid. In Illinois or in New Jersey, for example, even in Florida, it's about $17,000 per year. So if you're getting more than that per year as a single individual, you're not going to qualify for Medicaid. And so what we tell folks, especially when it comes to things like long-term care that are not covered by Medicare and not covered by other government programs, you don't want to qualify. You do not want to count on Medicaid as something that you're going to really it's going to take care of your long-term care, for example. And with Medicare joining into Medicaid, you can get some basically some special provisions and some special plans. But once again, it's all means tested, and a lot of folks do not qualify for Medicaid.
Yeah, and you mentioned another topic that we will be touching on soon, and that is long-term care insurance. So if you're wondering about that, stay tuned because we will have that video with Ben available as well. Now, if someone needs resources or they're just not ready to make that phone call yet, where can they go to find out maybe the slimmest version of this to just get the basic understanding of Medicare and how to help pay for it?
Yep. So they're always, of course, you can always go to Medicare.gov. Actually, Medicare.gov is a free resource provided by CMS, which is the Center for Medicaid and Medicare, and you can search for plans there. If you want to know how to apply for Medicare, you can literally Google apply for Medicare Part A or Part B. We help folks with that all the time to apply for their Part A or their Part B. And a lot of times, particularly if you're going to be taking Social Security, or if you're turning 65, your Part A will typically arrive kind of automatically if you've qualified for Medicare based on your 40 quarters. Part B, you typically have to apply for unless you're already taking Social Security at age 62 or age 63, for example. But yeah, those are the free resources. And then once again, you can always reach out to my team to get help with your Medicare questions, the basic questions, and also the process of getting the supplements or Medicare Advantage, for example.
Yeah, Ben Green, you are an impressive man. This is obviously not an easy topic to navigate, and we've really only scratched the surface here. So I would tell everybody who is watching now that if they have any questions whatsoever or just are not understanding the minutia of all of this, that is what someone like Ben is there for. And trust me, he knows what he's talking about when it comes to Medicare and everything that it entails. You are a pro, and we certainly appreciate you sharing your knowledge with us today. Now, Ben, if someone wants to get in contact with you, we see the contact page here, but if they're saying, oh, well, he's in South Carolina, who can you help?
Yeah, so we can essentially help anyone in the country. So I was just on the phone with a guy over in Texas this morning, helping somebody to enroll in Georgia tomorrow, actually, and we have clients in Connecticut, Delaware, et cetera. So even if we cannot officially enroll you, we can point you in the right direction and be a resource for people. And we're happy to do that. As I said, it's a personal passion of mine to provide this education. And I really want to thank you for your time and thank you for bringing me on. It's a great treat for me.
Yeah, and we will have quite a few more topics from you. And we are so thankful that you have provided your time for us here today to share your knowledge. Excellent job, Ben. And we will see you soon.
Thank you,
So
Melissa.
thank you. So, if you are looking for more information about senior living, you could head on over to www.seniorlivinglive.com. You can check out our video vault 24/7. Thank you so much for watching. Have a great day, everybody.
Bye.